Okay,
Okay,
please
cool.
continue.
All right. Okay, so epidemiologists are also called disease detectives, and I'm going to go through exactly why, but essentially we're investigating questions related to diseases. And so the definition is the study of the distribution and determinants of health-related states or events in specified populations. And I'm going to walk you through it. So by health-related states or events, we mean anything that can cause disease, disability, or death in populations. So that could be an infectious disease like Zika virus, which is spread by mosquitoes. It could be you're tracking teen pregnancy or accidents like house fires, or chronic diseases like cardiovascular disease. By distribution and specified populations, we mean person, place, and time. We want to know who is being affected, what are their characteristics. We want to know where this is happening geographically, what spatial scale, and then when it's happening, what's the time frame? Is it the last week, the last month, the last year, last decade? We want to answer all these questions. And by determinant, we mean causes. So what is causing this disease or death? And we want to identify risk factors to help inform people about them so they can reduce their risk, so they can live long, healthy lives. And a good example of this is we know that smoking increases the risk of lung cancer. So that's why you see all kinds of public messaging trying to reduce people's smoking habits. Okay, so mathematical modeling, we're going to incorporate that into these investigations. And this is describing the behavior of a system using mathematical concepts or language. We use mathematical modeling for everyday things like checking the weather, like today's super hot in Western Europe. I don't know what it is where you guys are. Kylie said it's super hot in the Netherlands. We use it for planning commutes. And so we can also use it to study infectious diseases. And it's particularly useful because infectious disease outbreaks and kind of processes, they vary over time. And sometimes you have feedback loops and other things that kind of make it quite complicated. So we want to use this as a tool to help us answer our questions. So why would we use R for public health? So these are some of the reasons that I thought of. Public health generally, but also infectious disease modeling. So it is commonly used in the field, so it kind of helps if you sort of speak the same language as other people. There are existing packages that can help do routine analyses, and I've listed some of them on the right. It's free and open source software, which helps with reproducibility, especially when you're doing studies in settings that are low and middle income and maybe don't have the resources to pay for software packages. And then it's flexible. So it allows us to customize our models and use it for what we need. Okay, so this is a little bit of my background, how I got to where I am. It's been pretty linear because since I was 15 years old, I knew I wanted to be an epidemiologist. I read this book, which I recommend, called The Demon in the Freezer, and that kind of inspired me to go down this public health track. So I studied biology in undergrad, then I did a master's in epidemiology, both in the US, and then I moved to the UK to do my PhD at Imperial College in infectious disease epidemiology, and that's where I met Kylie. She was doing the postdoc there. Then I moved back to the US, where I worked for the CDC for 2 years, and my talk will focus on my work there. And then 2 years ago, I moved to Paris, where I work at Institut Pasteur. Okay, so the first project I'll talk about is looking at how easily mpox spreads in one particular province of the DRC using two different R packages. So for context, this was before the 2022 outbreak. I was already kind of interested in this. And in some ways, it kind of foreshadows the global outbreak that we saw in 2022 and the current outbreaks that are happening in Africa right now. So for some context as to what this virus is, it's called monkeypox virus because the first outbreak was in monkeys, but actually that's not typically how it's spread. The first cases were in humans in 1970, and it is endemic in Africa, meaning there's just always kind of some sporadic transmission or outbreaks for the last several decades. And transmission happens from infected animals and humans. Historically, the mortality rates were 1 to 10%, depending on the type of virus. And there are antivirals and vaccines, but they're not widely available in the endemic countries. Okay, so the disease has kind of two phases, this kind of initial phase where people get fever typically and kind of malaise or fatigue, lasts a couple days. And then they have a rash, which lasts 2 to 4 weeks. And you see a kind of example on the right of what that looks like. It can have really severe complications, including vision loss, neurological complications, and death. So the quantity we were interested in for this analysis is called the effective reproduction number. And maybe some of you might have heard of it during the COVID-19 pandemic. It is the average number of secondary cases infected by a single primary case in a large population. And on the right, we have an example of an RT of 2. So you have, for every one person, they infect 2 people. And this number is a threshold. So when it's more than 1, your epidemic is growing. And when it's less than 1, the epidemic is declining. So we want to know what this number is and tell us about how a pathogen is behaving in a particular population. So the aims of this project were to identify clusters of mpox cases with the R package vines, and then use those cluster sizes to estimate RT and the spillover rate with the R package branch R. The spillover rate is how often the virus jumps from animals to humans. So in parts of Africa, the major route of transmission is from animals to humans, but increasingly, like with the current outbreaks, you're seeing a lot of sexual transmission or intimate transmission. Okay, so this package was kind of first developed and an application that had to do with dog rabies in Central African Republic, and then here's the paper for that. And I'm happy to put any of the links in the chat. So the data we had for this project was surveillance data. So surveillance just means routinely collected data about cases in a particular region of the DRC called Chuapa province. We had several years in the 2010s. And the 2 pieces of information we were most interested in were the time of symptom onset and their geographic location. So we had the village. Now, 2 complementary data sets helped, which one was a unique localities data set that just had the GPS coordinates of the villages. And unique because sometimes in a province or in a health zone, you might have villages with the same names, which means it's not unique, which that made it quite difficult for us to determine their location if they didn't have. I think we take for granted in places like Western Europe and the US that every place is mapped. There are some places that we don't have geographic coordinates for, or we don't know where a particular village is. So that was one challenge. The other type of data was called contact tracing data. So from the 1970s and 80s, this was during the smallpox eradication program. So they were looking for smallpox, but mpox presents very similarly. So those very good high quality data on mpox during this time. And contact tracing just means that once you have a case, public health authorities will follow up on all of their contacts to see if they also develop disease. And that can be a very good high quality source of data for doing these types of analysis. So like I mentioned, one of the biggest challenges was where are the cases. So sometimes for whatever reason, we didn't know where people were. So either we didn't have the GPS coordinates, which led to an actually interesting follow-up project where we had teams of people on motorcycles just going village to village and putting in the GPS coordinates like the villages here. So for future analyses, we might be able to do this better. Another reason we might not know where a case is that it was just missing or the handwriting was really bad. There are a lot of reasons because you're using paper forms. So that was one of the biggest challenges. Now, this is how Vines works. So you take your data source. So in this example, you have geographical data in the top row, and on the bottom row, you have genomic data. Then you calculate your distances, and then you can connect cases together based on how far apart they are. And then for this pruning step, you use your prior information about how connected the cases are to remove connections that you think are unlikely. And then the final step is you take the intersection. You take information from both types of data, and then you get your final cluster sizes. A cluster just means a group of related cases. So there was somehow transmission between them. It could have been a chain. It could have been one person infecting a lot of people. Cluster is kind of a general word here. And so for that pruning step, your prior information, this is what I was using for my analysis. So you had um, time information and distance information that we're using. And so we have the serial interval, which is time from symptom onset in a primary case and symptom onset in a secondary case. And then the spatial kernel is just, it kind of describes how far apart cases are in that high quality contact tracing data that I was talking about. Then you have your reporting rate and your quantiles, and these things determine what's called a cutoff. So the cutoff is basically the vertical line that you're going to draw in these distributions to determine whether two cases are related, essentially. And the reporting rate is just what proportion of cases that you're actually capturing in your data. And for some contexts, the reporting rate might be pretty low. Okay, and this is a bit of information about branch R. So once you have your clusters, you can estimate your reproduction number and your spillover rate. This assumes the number of secondary cases follows a Poisson distribution. And a Poisson distribution is just a distribution that you can use for counts, like single counts of things. And the mean equals the variance. And sometimes that is strong assumptions. It accounts for the underreporting that I talked about. This is prior information that you have. And then something important is that you should not use this for explosive epidemics. So you would not use these methods for like COVID or any massive outbreak because it's not built for that. Okay, so now I'll kind of step through the code workflow quickly. So the first step here is you compute the pairwise differences between your cases in time and space. So the first one is the times. So you just calculate what is the difference in time between two cases. The second one, I'm calculating the distance between two cases using the Vicente formula for ellipsoids. So it's not Euclidean distance because the DRC is really big. It's like as the crow flies, but accounting for the ellipsoid nature of the globe. Then the next thing is we input our prior information, so our spatial and temporal parameters. So for the serial interval, I'm using a gamma distribution. So we have our shape and our rate, and then we can get our scale. And then for the distance, I'm using a Rayleigh distribution, but other distributions could be used. So then I'm using a function from the package called fPairCase, and it just kind of, you specify with your input data distributions, what type they are, and you save them as an object. Then you can kind of put in your reporting rates and the quantiles. Again, the quantiles inform your cutoffs. And these actually come from simulation. So I'm not going to talk about the simulation study, but that code is publicly available if anyone wants to dig through it. I did find that quite a challenging part of the project. But yeah, you can try out different ones and just see how sensitive your results are to those. So the next thing is you're getting your cutoff. So where you're going to draw that vertical line on your distributions, kind of using, I think this is yet another function of the package. And then you can run BIMEs. So using your data, the differences in the distances, and then your cutoffs, and then you can specify like a color. Okay, then we use branch R to estimate R and the spillover rate. So this is just a big function. I don't think I changed this at all. It came from the package. Also, I see there's a lot of questions, but hopefully they're not, I can answer them at the end. Okay, then here's, this is also code from the package. Again, I don't think I changed this very much, but it's just, it's estimating your R and your importations, and then accounting for your underreporting and such. It gives you your spillover rate. At the bottom here, we're converting it into like an annual rate. So that's the kind of unit we're interested in. But okay. And then here are results. So this is what we're most interested in. And there are also different graphics that you can view that are built into the package, but this is just the general clusters. So these are all the cases that we had. Gray is a singleton, so they weren't connected to any other case. So it was likely like a animal transmission. And then, yeah, the colors just show a cluster. So we had quite a bit of data. Oh, to work with, and the reproduction number that we estimated was 0.81. So it is below the threshold of 1, but it is higher than historical rates. So this was kind of an indication that maybe the epidemiology was changing. We were getting to a point where outbreaks were going to be more likely. And then the annual spillover rate was 131. So every year we estimated that in this province of the DRC, 131 times was the virus transmitted from animals to humans. Okay, so to wrap up this project, I want to talk about maybe some reflections as a package user. So in 2 instances, the R package didn't exactly fit my needs. So in this case, you can do one of 3 things. You can either try to modify it yourself, you can submit an issue to the GitHub repo, or you can email the package author. Fortunately, I knew the package author. He was my PhD supervisor, so I emailed him for some help. And fortunately, he had the time and interest to make the changes to the package that I needed. But that is definitely not always the case. In other instances, I've emailed package authors, and they do not have the time or the interest to make those changes. They've moved on to other projects. So it doesn't always work. But in this case, it did work, and I was able to get it published, and I was quite happy with the final analysis. So this is the publication, if anyone's interested in reading about it, and I can certainly put the link in the chat afterward. So this was published in the American Journal of Tropical Medicine and Hygiene. Okay, and for anyone who's interested, here is the documentation for the R packages. And again, I'm happy to put these links in the chat. There is a vignette for VIMES, which is pretty good. It's for the rabies one. So I use that as like a starting point for my analysis. Branchar, I don't know if there's a vignette, but like I said, I didn't need to modify that code very much for my needs. Okay, so that's the first project. And how are we doing on time? We're doing pretty good on time. So now I'm going to talk about a totally different project, which is rabies risk assessments with RShiny. Okay, rabies, if you're not aware, is a neglected tropical disease. It causes 59,000 deaths a year, roughly. It is one of the deadliest viruses there is, with a fatality rate of about 100%. And it is transmitted primarily via bite from an infected animal or human. It can also spread by organ donations, for example, but primarily via bite. And transmission is maintained within reservoir species. So there's different animals. Any mammal actually can get infected with rabies, but certain regions have certain animals that either don't die or they are able to survive a long time with rabies. And so the virus can continue to be transmitted. This is the clinical course of rabies. So like I mentioned, it's almost 100% fatal once symptoms appear. But if someone gets vaccinated after an exposure, almost 100% of the time they will live. There are exceptions, like if someone's immune compromised. But basically, once symptoms start, that's kind of the beginning of the end. So the incubation period is around 2 to 3 months. And you can see in the graphic here how it works. So the virus enters through the saliva. And so once the virus enters the skin through a bite, the virus travels up the nerves to the brain. And once it's in the brain, you get kind of systemic infection. It changes the behavior of the animal or person to make them more aggressive. It actually makes them afraid of water and afraid of wind drafts and things that will make them likely to bite someone else and transmit the virus. So it's kind of like the original zombie virus. So the initial symptoms will be fever and pain at the wound site, but then something might not happen for months, and then all of a sudden they'll have encephalitis, and then it's a really bad way to go. But yeah, death can last days to weeks in that state. Some people have to be like fixed to a bed or something like that. Okay, so what do we do about this? So in the US, where rabies is endemic, we do risk assessments for exposures. And so we want to know if you have to give PEP, which is post-exposure prophylaxis. So that's the vaccine. Usually you give a vaccine before someone's exposed, but in the case of rabies, it's after. So we ask some key questions. Was there an exposure? Is the animal a reservoir species or a high-risk animal? Then we want to know, what is the rabies epidemiology in the area? Like, is there a particular animal that is a concern? And then was the animal showing signs of rabies? And then typically I mean, these assessments are done by veterinarians and trained public health officials. And so they have quite a good idea of what the risk is, and they kind of bin it into no risk, where you don't need PEP, low risk, where you may need PEP, and then high risk is where you definitely need PEP. And again, it's not an emergency. You don't have to typically run to the hospital, but like you want to get it sooner rather than later. Okay, and that was essentially the aim of this project, was we wanted to develop a model and a tool which could be used to improve PEP recommendations when an animal is not available for testing or observation. Because typically the first step is wait to see if the animal shows symptoms, but if you don't have the animal, you can't do that. And to test the animal, you have to euthanize it. So we typically want to avoid that if we can help it. And this is kind of a brief overview of rabies surveillance in the US. It's quite an extensive system. We have both passive surveillance. So these are public health laboratories that are getting animals submitted to them. So like your local vet might submit an animal to the laboratory. Or you also have the US Department of Agriculture that go out and do testing. And so we have over 4,000 samples that are positive each year of different animals. And then CDC and Department of Agriculture talk to each other to develop recommendations. So every year we have this annual surveillance report for rabies, which shows you like the geographic regions with the animals that are at risk. And then it also informs the USDA's oral rabies vaccination program. So this kind of can help keep a particular rabies reservoir in a particular area and make sure it doesn't kind of spread into other parts of the country. Okay, so for this project, we used some predictors of rabies in animals and humans to come up with this tool. So for animals, we looked at geographic location, species, their health status, and then circumstances. So provoked and unprovoked means like if it's unprovoked, it means you were just minding your own business and an animal bit you. And provoked means you did something to it. You pulled its tail, you bothered it in some way to make it bite you. So unprovoked is usually more risky and provoked is like it may not be related to rabies. And then vaccination status. So obviously having a vaccine is protective, but not all animals get vaccinated. Typically pets like dogs and cats will be vaccinated. And then in humans, we looked at severity. So how bad was the bite? Typically more severe, more likely you're going to get rabies and the more quickly it will happen. And then anatomical location. So the head is the worst place to have a bite along with the neck. And then the further from the head, the better. So that's the more time you have and actually the least likely that rabies will develop. But still, any bite is a chance that it could develop. And there are also some cases where, like I said, you can get rabies without actually being bitten, like organ transplants. And then there's some questions about whether bats can spread rabies without a bite, but it's a bit murky. Okay, so for data, we used 10 years of national rabies surveillance system data in the US. This is a million data points. So we have a million animals that have been tested in that amount of time. So that's a huge amount of data. And then the literature for the other aspects that weren't captured in the data. So while the data, we have a lot of it, it's only certain variables. It's actually only like 6 that have to be reported. Okay, so for data challenges, so some of the other variables we were interested in, like I said, were not available for all the data for all the states because it's not required. And then data quality for the probability of death. Because we've had rabies vaccines for so long, actually, it was invented by Louis Pasteur in the 1800s. Not many people, we don't have that good of data about what happens when somebody gets bit and they don't get vaccine. Almost always they're going to try to get vaccine unless the vaccine is not available or they can't get to the treatment. So a lot of the information for this parameter comes from historical data, like very old data from like maybe the 1800s or the 1900s. Okay, so methods. We did math. I can definitely elaborate on that in the questions, or you could read the paper or ask me later how we did it. But essentially, we're interested in 2 quantities. So for the probability that an animal was rabid, given that someone was bitten or exposed, and then the probability that someone could die, given that they were bitten. Now, the second one is a bit theoretical because we don't actually make public health decisions or medical decisions based on that. It's just kind of another quantity that we explore that might speak to some people in terms of their own kind of assessments, being comfortable with a certain level of risk. But actually, the first one we're actually most interested in is the most practical for public health. So another part of the methods, something we did was we did a survey of state public health veterinarians to determine a risk threshold. So we gave them a bunch of different scenarios. We said, given this information, would you recommend rabies based on your expert opinion? And that helped us get a threshold to compare to. All right, so now I'll talk about the tool. So what is a Shiny app? Some of you probably already know what this is, but maybe some of you don't. So I'll just briefly tell you. It consists of a web page or a UI connected to a computer, which is running a live R session or a server. And so if someone makes a change to the graph on the left or to the inputs, and then it kind of talks to R and it's running code, and then the page on the left updates based on that. Okay, so I wanted to develop a Shiny app that could be used by state and local public health officials. And so this is what it looks like. It looks quite friendly with these little pictures of animals. And the reason why I picked Shiny was because the previous tool that like CDC was using was Excel. And I felt like that was quite limiting, especially if you wanted to update it. You'd have to ask everyone to like re-download it. And it didn't cover all of the scenarios that we're interested in, and it also didn't really quantify the risk. I mean, it did, but not well. It was like a point-based system, which was collapsed into categories. And I really wanted a number, essentially. So how it works is you filter down a data set based on a user selection. So I kind of pre-computed all of the probabilities, and then I wanted to present it to the person who was looking for information. So I have the two tabs here. So this one is showing the probability of that an animal's rabid given an exposure. And then it has the questions that you would ask. So, and then you kind of filter it down and then you get the quantities. So the median, it's the central estimate that I picked. That's the one you're going to base it on. And then we also quantify uncertainty. So we have the 95% credible interval. So we have the lower limit and the upper limit. And then this is what the other tab looks like. So there's a couple more fields for questions. It adds in severity and the location of the bite. Okay, so how I did this, there was already a tutorial. Great. This made my life easier. So this was written in 2018 and the link's here. I can put it in the chat, but it kind of stepped me through how I would build this app. Some extra features that I added was a pop-up box. So this was probably for legal reasons, but basically saying this is a tool that is meant for trained public health officials, and it should not be construed as medical advice. Anyone can use it. I'll talk about where they're available and such later. But just to say, like, FYI, this is just use this with caution. It's really for trained people to interpret. And then for the first tab, I wanted to have an interactive bar graph to help with the interpretation. So in this plot, you can see the threshold. So that was estimated from the survey that I did of all those state public health veterinarians. And then you could take the estimate from the data set that you filter down and put it in the right boxes. And then you could visually see whether the risk of the exposure was higher or lower than the threshold, or at the same point of the threshold. And the interpretation being, if the estimated risk is higher than the threshold, someone should get PEP. If it overlaps with the threshold, you might consider it. And if it's lower, it may not be recommended. Okay, so in terms of sharing, there are 3 ways to share a Shiny app. One, which I didn't put here, is building your own server or something. That sounded too hard. So I went with the other 2 options. So CDC has internal kind of Posit Connect thing where you can have apps hosted internally, which has unlimited use hours, which is great, but then you need to onboard external people, which is going to be most of the users, so people from all the different states. So I also wanted to have an external version just for anyone to be able to look at, but this one only has 25 active use hours per app per month, so that's like 30 minutes per state, so it's really not that much. But if anyone wanted to check it out, they are publicly available here, and I can again put the links in the chat. What's nice about this is it has usage tracking. So this is the one for the public app. So this was, whenever I checked this, it was just showing the last week. So it had been used 1.7 hours. I don't know what's happening internally because again, I don't work there anymore, but I'm told that they still use it. In terms of updating the tools, this was just a kind of ballpark that I came up with. So I thought maybe every 5 years. Rabies epidemiology doesn't change that quickly. It's pretty consistent. But say if you did notice some host shift event happening or something significant, you could update it more recently. But I think given that it includes 10 years of data and a million data points, you may not need to update it very often. And something important is that I left a very detailed standard operating procedure. So for whoever was there after me, they could update it with hopefully minimal issues because I was very specific about what needed to be done to do that. All right, so we're doing on time. We're doing okay on time. So I wanted to step through the code just for the Shiny app. Again, I'm kind of skipping the math and how I got to the estimates, but this is kind of how you build a Shiny app. So the first step is you have to load in your packages, and in my case, the data are like the model estimates, and then I did some formatting. So this is just this first like top bit. So then you want to create a Shiny app object using the Shiny app function in the Shiny package. So here we have Shiny app, and there's two parts to this. So the first part is the UI. So you have to define this within the function. And then the second part is the server. And this is the part that's rendering the output. So that's the part that's kind of talking to the display that someone is looking at. I don't know if I've explained that very well, but okay. So the next thing is to run your app. So there's your little R session. You can see it's circled here, a button, and you click it, and then hopefully it will pull up the app and allow you to see it. And then you can publish your app in one of the three ways that I mentioned. Okay, so here are my top tips for developing a Shiny app. And this was my first time, so I learned a lot. The first thing is you can read the documentation. It's actually very good. Then look for inspiration or tutorials. Again, if someone has done the thing that you want to do, it's a good place to start to just kind of see how you do it. Then there's a great cheat sheet, which has a lot of the key components, things like layouts and other characteristics features. Then I would recommend starting simple, like do the very basic architecture of what you want, and then build up the features. These are very difficult to debug. So be very mindful about your parentheses and your commas. I like to use the rainbow parentheses. I'm sure you pros already know about that, but I find it helpful to keep track of parentheses. And then, like I said, they're super difficult to debug. So I would, anytime you want to add a feature, I would recommend saving the version that you have because you could very easily change something and break it, and then you don't know where that happened, and you cannot go back to what you had before. So that's very important. Just every time you want to add something, like save it in a new file. Okay. So coding challenges. So again, I think the most difficult thing for me was coming up with the methods to calculate the estimates, the mathy bits. Fortunately, I had some colleagues that could check my math. And then formatting the Shiny app. So getting the pictures in there, getting the tabs and all the things that I wanted looking nice. Some reflections. Sometimes there is a gap between like the latest tools and real world needs. So a lot of people were kind of hesitant to adopt the Shiny app because they really liked Excel and it was working for them before, so why should they change? So the dialogue with your end users, I think, is super important, and making sure that you're going to make a tool that is actually going to be useful. And then it is published, so feel free to have a look at the paper, and I can certainly put the link in chat. Interested. Some overall reflections, again, not necessarily related to what I said, but on the field, I do find that there is a tension between creating new packages versus updating old ones. So this kind of gets back to what I said about what happens when a package doesn't fit your needs. Some people are more inclined to create their own package because then they can kind of get a paper out of it rather than going back and improving old ones. So I do think that maybe this could be improved in the field. And it could also maybe benefit from a more thorough review of existing R packages for the field and could also help direct users, maybe at public health agencies, as to which packages or tools could best accomplish what they want to do and what are the limitations of all of those packages and methods. Shameless plug. I am part of a community called EpiNowCast, and this is a group of infectious disease modelers doing analyses in real time. So if you're interested, feel free to check out the website. We have monthly seminars on the first Wednesday of every month, and it's people from mostly Europe and the US, but it's a great community. And there's also a forum for people to discuss. So I encourage you to check this out. And then finally, here's my contact information, and I'm happy to take any questions and also look at all the things in the chat. That's it.
Thank you, Kelly. That was great. Yeah, we did have some questions during the talk. One was from Thomas. Thomas, you're welcome to unmute and ask it yourself. Otherwise, I can ask it for you.
I think the initial one was just more like, are you taking these coordinates, calculating the geodesic distances, and then that's part of what's being fed into the model? Just trying to understand how that was being calculated in the workflow.
I used a function that someone else wrote. It uses the package IMAP, and it just takes the geographic coordinates. What is the distance between them? Accounting for the curvature of the Earth. So if it's short distances, you can use Euclidean distance, and actually that was what was used in the rabies paper, the 2018 paper where the method was kind of developed. But in my case, I used this other formula. And so it is, yeah, I didn't show it. It is a function that I like grabbed from somewhere on the internet, and it worked pretty well.
As you do. But
Yes.
yeah, thanks.
Mhm.
And then there was another one from, I apologize if I say this incorrectly, Sign Kim. If you are still here and want to ask, you're welcome to. Otherwise, I can just ask it. Okay, no takers. I'll do it. They were asking whether you could explain, I think this was on the first part, if you could explain a bit more about the format and types of the data that is needed. For example, do we need like the location, like GPS info of where the cases came from, and also the time they were detected? I think this was to do with the monkeypox work.
Yeah. So actually, you can use any type of data for which you can calculate a distance that makes sense. So even if, I mean, if you had, say, income, you can calculate a difference in income and use that. But ideally, it should be connected to the transmission process of the disease. So typically, time and place are, getting back to person, place, and time. In epidemiology, that's what we're most interested in. So if you genomic distance and it makes sense for your pathogen, go ahead and use it. You can actually use as many as you want. There's no limit. But again, it kind of should be related to the transmission process, if that answers it.
Sounds great. Yep, I think so.
So if you don't have time, but you have distance and genomics, great. I think you need at least two, because actually if you only use one, you get one big cluster of all the cases. They're all connected somehow. So that's why it's important, I think, to have at least two.
Okay.
Three is better.
I can see how even if you don't have geographic information, but you do have, for some reason, genomic sequencing, that can help you sort of basically.
It depends on the pathogen. Even if you have genomic data, if it's a like DNA virus versus an RNA virus, DNA tends to evolve quite slowly. So you may not see meaningful differences in the differences between.
This might be a dumb comment, but I thought all viruses were RNA.
Monkeypox is a DNA virus.
Okay, so you learn new things
and smallpox. So they tend to evolve more slowly.
Okay.
Yeah, RNA I think is more prone to mistakes because they only
Yeah,
have the one copy. Like if you have DNA, you have to go to RNA when you're
yeah,
transcribing. So
yeah.
making copies. Were there other
Interesting.
questions?
Those were the main from the chat, but I'm actually interested because you at the end you started talking about like, okay, how do you approach using someone else's tools or creating your own? Um, and I've I tend to create my own, not because I want them to be published and I want to be able to wave a flag that says, look what I've made, but more because I sometimes find it difficult to find the right tools, or sometimes they're not super well documented. And if I don't know how they work, then I can't be sure that I'm using them correctly or I understand the assumptions that are being made. And so I just wonder if in the course of trying to find these tools, you've encountered some of those issues and sort of how you've navigated that.
Yeah,
And
so
sometimes people aren't super nice about collaborating. So people may not want you to touch their code. So if you want to extend it, but you don't know them personally, they may not be open to it. So yeah, I'm just curious about your experiences with sort of dealing with that situation.
yeah, so I do get what you're saying about uh if it's not documented well, you may not trust it as much. So it's worth making your own tools. But that's kind of a public service announcement to anyone writing code that, again, a lot of this research is publicly funded, whether it's in academia or even in public health agencies. So everyone should strive to make their code very well documented and extensible. That's like a good practice, I think. So I mean, I've never encountered anyone that didn't want their code being used. I know some people get annoyed if their packages are like say their code is extended, but it's not cited properly. I think that's super important. And the idea that if you cite something in the supplement, it doesn't get reflected in citation indices or I mean counting. And for a lot of people, that's still a really important metric for getting grants or promotions and stuff. So if you are using anyone's code, you should cite it. If you're extending it in any way, I think you should cite it. And I really try to cite all the R packages that I use. I mean, outside of like ggplot2 or like some things that are just so routine that
Yeah,
I
but
just don't.
I've had a whole argument about this. But should we
Are you
also
supposed
have
to cite?
I mean, well, so a lot of people restrict their citations to what was actually fundamental to the analyses. You know, what did I need to do to perform my analyses? But when you think about it, how do you represent your analytical results? You plot them and you use ggplot. And so I'm just wondering, like, should we, this is open to anyone for discussion, but should we not cite those two? Because they fundamentally enable us to present our results. Same with things like dplyr. It's like
Yeah, but maybe not
they
in
allow us.
text. Like
No,
I know
I
some
put them in the
reviewers.
supplement. So I have a
Yeah,
whole,
but the supplement bad. No, because those don't get you don't
well,
get metrics for those. So we
jour
need a better solution.
okay, but journals have reference requirements. So right now I've just listed all the packages that I've used in the supplement. I've got a section that says like resources or whatever, and
But
I cite all
that's
of them.
good, but they don't get reflected in the metrics. That's the issue.
Okay, but if a journal says you can only have 50 references and I use 30 packages.
I think there should be a section of the paper that says, here are all the software packages that I use. So it is cited in the main text, so it does get picked up by the references, but it's not like some people peer reviewers get super annoyed if there's too many in-text citations about software and packages.
So
I don't know.
Thomas
I'm
is
not in
just
charge here. I'm not in
no,
charge of a journal, but like,
no, I know.
I think it does need to change.
Thomas is commenting in the chat that he's a fan of including the like virtual environment and requirements and stuff with the version.
Hmm.
Um, but the citation is still there in the paper. Yeah, yeah. I mean, I've seen people put very specific information about the version and everything sort of in their documentation, say in a repo or some sort of like tutorial of how they went about doing their analyses, but that information typically doesn't go in the paper. But yeah, I had a whole like discussion on LinkedIn months ago about this very thing because it's like we are using these packages and people spend time and money, and companies like Posit spend all this money to make these packages that are routinely used, but how do they actually know how widely they're used if we never cite that we're using them?
Mhm. Yeah.
And it's still an open question, but I'm trying to at least cite them somewhere, even if that's only in the supplement.
Yeah.
So, um, yeah,
Or other questions?
I don't think so. Does anyone have any other questions? Well, I'm curious to know if you are ever going to build your own package or if you're pretty resolute on just using the tools that already exist.
Wait, let me, um, um, probably not. I think the route I'm going with my career is maybe a little bit out of the research realm. I might do like a bit of research going forward, but I kind of want to focus on other things. I do have my political ambitions.
Right, yes.
So
Um,
maybe not. And I'm not the most technically person. I can really understand other people's stuff and like I like to think of myself as a package user. I'm not as much of a
right.
developer.
See, this is where we differ, Kelly. I love getting in there, developing it. I think that's part of why I just do it myself because I'm just like, hey, I could use somebody else's and it's no doubt better. But then I wouldn't get the fun of trying to create it.
Hmm. Yeah, I don't
Um,
think I'm as interested in that, but yeah.
so Mohammed has asked if you could share the Shiny dashboard tutorial.
Yes. Let me get out of here. The sharing. Stop sharing. Yeah, I have that in my slides. Out of here. Okay. And it's a little outdated, so all of the examples might not render, but this is the code that I use, and also the my code is publicly available, I think, in the GitHub. Okay, here, that's
Yeah,
this one.
I tried. Awesome, thank you. Yeah, I tried to add links while you were talking, but I missed this one.
Any other links or questions?
Any last minute questions? No, but Mohammed says thanks.
No problem.
All right. Well, I mean, this has been fantastic. Thanks everyone for joining. You're always free to get in touch with Kelly if you have any follow-up questions or just want to chat. And yeah, glad that you all joined us. And if you are currently in Western Europe,
Yes, the project code is public for mine. I would just go to my GitHub. It's just K Charniga. It's my like ID thing. Should be able to find it. And
yeah. And
the
if
Shiny apps are
and if
public.
anyone wants to save the chat, there are three dots at the top, and you can save the chat so that you
And
have all these
also
links.
another thing, I don't think I was that clear about it, but if anyone has a rabies exposure, do not use the tool because it's only for the US. I mean, unless you're in the US. Otherwise, don't use it. And actually rabies is eliminated from most of Western Europe, so you actually shouldn't have to worry about it in the Netherlands.
Yeah, we don't actually have rabies here.
Unless you're traveling. If you're traveling to like Africa or Southeast Asia, then that's a different situation.
Yeah, but we still have to get vaccinated. Like pets have to be vaccinated for it, but we don't think we have it here anymore. I think they eradicated it, but don't quote me on that.
No, I think that's right. And the same in France. We actually do the surveillance for rabies here at Pasteur.
Oh, okay, cool. I'm sure they do it where I work too. I just don't know them.
They're fun people. They get animal heads in the mail.
What?
Yeah, that's like that. They mail animal heads in. So if you come in the morning, like they just get a bunch of animal heads. Test. You need to test the brain.
Oh,
Yeah,
like a decapitated.
decapitated.
Right. Okay, that's fun.
Yeah.
Are they at least in a cooler of some sort?
I think they
Or
should
they're just in
be,
a brown box?
they should be. But in the US, we have such a diversity of animals. The CDC would sometimes get like, I don't know, polar bear heads or like moose heads.
Wow, that is
Yeah, yeah, you have
fascinating.
to test the brain, basically.
Oh,
Oh, wait,
okay.
a
So,
quick question about learning
yeah,
the entire R package. The entire R package or R software? I think she means R software, or he or she, I'm not sure. Um,
our
R
software.
software. So when I started my PhD, I was kind of dropped into the deep end there because I had only learned SAS and Stata, which is kind of the staple still. It's a lot of US universities because that's what the professors learned and they can't be bothered to learn R. And why should they? They can pay for the expensive software. Anyway, how would you start? I think the best way to learn software is through practical. I think it's very hard to learn theory. So I was part of an R book club where we read Advanced R by Hadley. But I, again, find it quite difficult to just read a book. You kind of have to have a project. So, okay, there's some nice, yeah, some links there. I think practicing and then maybe asking people for help if you're really struggling. Um,
Yeah,
but
so
yeah, I think that's the best one.
my experience was it's easier if you actually have a problem to solve. So rather than trying to say, I'm just going to learn R, actually have a task that you need to do. Like say you want to build a Shiny app. So go through or you want to do a particular analysis. Just use that and then learn sort of every step. Like, okay, I need to read in data. Okay, I need to manipulate data. Okay, I need to do some sort of statistical test on it. And through that, you start to learn how things work, and that's more effective than just, and it sticks better. I would ask questions about errors and stuff to AI, but I would not use too much AI just because it will just do it for you and then you won't remember. Um, so I would stay away from AI unless you're like really stuck. Um, oh, okay. So we have another question. I think this is actually for me from Bianca. About how the Our Ladies community works. Okay, so Our Ladies, probably should have said this at the beginning, is a global organization. So we have a global leadership team, but then there are local chapters all over the world. There's a bunch of them. And each chapter has its own leadership. So I'm an organizer for the Amsterdam chapter, and they host sessions online, in person, and they can range from workshops or just having people sort of talk about what they do, like Kelly's just done. Or they can just be, hey, let's all get together because we love R and we want to connect and have a drink somewhere. And they can, so they vary. Anyone is open to being a member, and sort of the whole point of Our Ladies is to promote minority voices in the R community. So like historically, it was dominated by men, and so this is or cis men, and so now Our Ladies is trying to promote sort of gender diversity in the R community, and so a lot of the speakers, or most of the speakers, will be women or gender minorities. And yeah, every chapter has events posted on Meetup, and a lot of them have Blue Sky accounts or LinkedIn pages. So have a look at your wherever you're located. And there's also now a new chapter called Our Ladies Remote, and it's for people who live somewhere where there is no local chapter. And so they also organize online things so that you have a sense of community. But I personally belong to like Our Ladies Rome, Our Ladies Philly. It's just whoever's having a session that I'm interested in, I'll join their chapter so I can attend. And it's always free. Yeah, so I hope that explains a bit. And as I've been talking, people have been sharing some resources, so that's awesome. Yeah. So great. Very happy that you guys are active in the chat. Nice. Kelly, do you have anything else you want to add?
Nope,
Nothing?
not really.
Okay. So I think it was somebody asked, I will email whoever asked for the chat. I will save it and email it to you. Yeah, thanks. Thanks again, Kelly, for taking the time to chat. And thanks everyone for joining and asking helpful questions and suggesting useful tools in the chat. It makes the community what it is. So thanks, everybody.
Yeah, thanks for having me, and stay cool, everyone. It's very hot
Yes.
today.
Yeah, stay cool.
No problem.